Hello, my name is Troy Yocum. I'm going to be presenting a comprehensive history and physical assessment for nursing 5602. My patient, her name is Jane Smith. She lives in 1023 Maroon Drive in El Paso, Texas. Phone number is 915-867-5309. Date of birth was May 5th, 1963. She's a self-pay. Comes in with a chief complaint stating that I've been having the worst abdominal pain of my life. History of present illness. Ms. JS is a 53-year-old Hispanic female who presents to the ED with 2 weeks of increasing abdominal pain. The patient reports that she first noticed unexplained abdominal distension with mild abdominal discomfort and changes in bowel habits. Then the pain has steadily been increasing over the past several days to a point where she's been missing work. And during the past 2 weeks, she's been having increased abdominal pain with cramping, gas, and bloating, as well as constipation and diarrhea. She says she normally has regular bowel habits, between 1 to 2 stools daily, and she characterizes as normally soft brown, but the past 2 weeks she's been also having some jelly-like, mucus-like substances in her stool. JS also states she's had no prior abdominal or gastrointestinal problems, but has currently had a poor appetite, weight loss, feels stressed, and has low energy. She describes the abdominal pain as stabbing-like pain in the right lower quadrant, which radiates to the back. Pain level fluctuates between a severe level of 10 to a discomfort level of 2 for her. Lasts between 10 and 30 minutes and is located in the right lower quadrant. She states that she believes spicy food and stress has also been aggravating her symptoms, but pain was being managed with Tylenol over the counter and minimal and decreased intake of spicy foods. Past medical history for her. She had reoccurring respiratory infections that required antibiotics as a child. She was diagnosed with hypertension and hyperlipidemia in 2007. Past medical history. She has had a tonsillectomy and appendectomy. She's also had a benign cyst removal with the last mammogram in April of 2018. No allergies, but current medications that she's been taking. She takes lisinopril 5 milligrams daily, hydrochlorothiazide 12.5 milligrams daily, simvastatin 10 milligrams at bedtime. She also takes a Centrium multivitamin once a day, and then currently been using over-the-counter Tylenol 650 milligrams for pain. Social history. She denies any tobacco or illicit drug use. States that she does drink alcohol once or twice a month and consumes between 2 and 6 drinks on occasion. Denies any recent travel abroad. Family history. Her father has hypertension, hyperlipidemia, ETOH. He's had a bowel obstruction with surgery. Mother has hypertension. She has heart dysrhythmias, chronic back pain, colitis, osteoporosis, and arthritis. Her sister has hypertension and she has gluten intolerance. Her brother has hypertension and hyperlipidemia. Grandfather has hypertension and diabetes and died of a heart attack at an unknown age. Grandmother had colon cancer and died from the complications at 59. She's currently up to date on all her immunizations and flu. She had her recent mammogram in April of 2018. She's pending one in April. She denies that she's ever had a colonoscopy. Psychosocial history. She was born and raised in Juarez, Mexico, but currently resides in El Paso, Texas for the past 25 years. She is recently divorced with one child, age 14, that lives with her. She says she's not sexually active and has never had any sexually transmitted diseases. Review of system. Constitutional. She reports the abdominal pain, distension, and changes in the bowel habits with decreased appetite. She's been having weakness, low energy, but denies any fever, sweating, or chills. She reports that she has lost 8 pounds in the last 2 weeks as well. She reports that the abdominal distension, pain, and cramping has been steadily increasing. She's been having on and off of constipation and diarrhea. The pain is been sharp, and it fluctuates in pain from 10 to 2, and it goes to the right lower quadrant. And spicy foods and her stress level, she believes, is aggravating it. Mental health for this lady. She denies any depression, but she does say she did state that she feels stressed with her current divorce. On physical examination, she appears to have to be a great historian. She looks younger than her stated age. She's appropriately groomed. She's alert, oriented ×3, under no distress, and she's very cooperative with the physical examination. Vital signs: heart rate is 123. Blood pressure is 89/51. Oral temp is 36.5 degrees Celsius. Respiratory rate of 21 breaths per minute. Current pain of 10 out of 10. She's 68 inches tall and weighs 164 pounds. Head is normocephalic with no lesions or bumps. Her conjunctiva is pink. Sclera is clear. Pupils are equal round reactive. She has no hemorrhaging. Her ears are symmetrical, shape and size. She has no foreign bodies or drainage from nose or ears. Her mouth, oral mucosa is pink but dry. Has no masses, lesions, teeth dentition is intact. Her neck is symmetrical. Thyroid is non-palpable. No jugular venous distension or crepitus. Respiratory, she is tachypnic, but she appears to not be in any distress or labored. She has equal rise and fall of chest. Breath sounds are clear to all extremities with no advantageous sounds. Cardiac wise, her S1, S2 are audible with no advantageous sounds. Pulses are +2 to all extremities as well as carotids. Capillary refill is less than 2 seconds and she has no edema. Her abdomen is round, distended, taut with no discoloration or jaundice, cyanosis, or redness. The contour of her abdomen is symmetrical but rounded with a slightly distended and bloated. Bowel sounds are hyperactive to all 4 quadrants. The abdomen is tender to deep palpation. No mass is noted, and the liver and spleen are non-palpable. Also, her bladder is non-distended, non-tender. Her breasts are round, equal in size with no masses or lesions. Her gait, she's full weight bearing. No weakness. Strength of 5 out of 5. Spine is straight and midline. All extremities will have no masses or lesions or trauma. Skin is warm and dry, and neurologically she's alert, oriented ×3. She's coherent. She's calm, cooperative. Mood and affect are appropriate to situation, and cranial nerves are intact. Labs and diagnostics were done prior to assessment. CBC White count is 6.5, hemoglobin 19.9, hematocrit 54.6, RBC is 4.87, platelets were 267, CMP or sodium was 154, potassium was 4.2, chloride was 111, BUN was 16, creatinine 1.8. And there was an abdominal ultrasound done that was normal. No, nothing was found. A guaiac was done and was negative. So based upon assessment, Ms. JS, she was a 53-year-old female who presents to the emergency with severe abdominal pain, constipation, and changes in bowel habits for the past 2 weeks. On the physical examination, her belly is round, distended, and taut. The bowel sounds were hyperactive to all 4 quadrants. The abdomen is bloated, and it's pain to on deep palpation. Her mucosa was dry. Patient also states that she's been feeling cramping and gas, and that sharp pain that's been radiating to the right lower back, and the pain's been fluctuating between a 10 and a 2. That's been intermittent, lasting 10 to 30 minutes long. Additionally, with the decreased appetite, weakness, low energy level, and loss of 8 pounds in 2 weeks, and the concerning of her stress, her stress from divorce, have also increased the gastric irritants, and also concerning is her family history with prior abdominal illnesses in the family history. And then vital signs concerning for me were her heart rate's 103, blood pressure's 89.1. She's a little tachypnic at 21, the severe pain, and then the 8-pound weight loss. White count unremarkable, but her hemoglobin hematocrit was a little elevated at 19.5 and 54.6. Sodium was elevated at 154. Chloride was elevated at 111. BN creatinine was 16 and 1.8. And then her abdominal ultrasound was normal and guaiac was negative. So my differential diagnosis was primary. I'm going with irritable bowel syndrome. Secondary would be peptic ulcer disease. Thirdly, H. pylori, and then a can't miss for me was gastric cancer, especially due to family history. I ruled out AAA after the ultrasound. So plan of treatment for her would initially be give her a 1 liter LR bolus. If the hypertension doesn't resolve, we'd send her to ICU. If the hypotension resolves, we'd send her to a telemetry monitor unit. Do a chest X-ray. Repeat CBC, CMP, MAG, FOS in the AM, and abdominal CT due to the severe pain. We're going to check a H. pylori breath test. Start her on Protonix 40 milligrams daily. Dococet 100 milligrams daily for the constipation as needed. Continue her current medical treatment regimen with the lisinopril, 5 milligrams daily. Hold her hydralazine due to possible dehydration. Restart her simvastatin 10 milligrams daily for bedtime. We're going to do some dietary changes. We're going to eliminate the high gassy foods like the carbohydrated beverages, alcohol, caffeine, raw foods, fruits, and raw vegetables like cabbage, broccoli, and cauliflower. Also, we're going to eliminate the glutens, wheat, barley, and rye. Increase her fluid intake, as well as start her on a fiber diet. Encourage physical activity, and this will help relieve her stress and stimulate her normal intestinal bowel movement. And then when she gets discharged, encourage her to start trying to walk at least 30 minutes a day and then increase intervals as tolerated. Also, we're going to consult GI for a colonoscopy due to family history, strong family history, maybe cancer. And then we're going to encourage her to have a pelvic and pap smear yearly. Make sure she does a self breast exam monthly due to her history. Also a mammogram yearly.